Welcome to our video on spider bites. Let's get started. In this lecture, we'll be discussing two of the most important spider bites to be familiar with, the brown recluse and the black widow. Let's begin with the brown recluse. Here's a list of topics we'll be discussing for brown recluse spider bites. Let's start with the clinical presentation. The clinical presentation for a brown recluse spider bite may not be obvious. The patient may have no recollection of being bitten. The typical progression is an initial painless bite that progresses to have an erythematous border around a purple center. This lesion can then eventually blister. After the blister forms, the lesion may become a bluish-black color before further progressing to necrosis and eschar formation. The patient may also present with systemic symptoms related to the bite, including but not limited to fever, malaise, nausea, vomiting, muscle cramps, and DIC, but it's uncommon to experience these with a brown recluse bite. The image on the left shows a patient with a brown recluse spider bite. You can see on their fifth finger an area of erythema and potential edema. As this wound progresses, it could potentially blister and lead to necrosis. The image on the right shows a brown recluse bite 4 months after the initial bite. In this image, you can see the significant scarring that occurs secondary to the bite, and this is due to tissue damage from enzymes in the spider's bite. Here's a picture of a brown recluse spider. These spiders are endemic to the southeastern and midwestern United States. If the patient describes a brown spider and has an erythematous bite or signs of necrosis, you should be highly suspicious of a brown recluse bite. The biggest complication associated with brown recluse spider bites is the damage that enzymes in the venom cause to local tissue around the bite site. If severe, the patient can experience necrosis of the skin as well as adipose tissue in the area. Additionally, the necrosis of tissue provides an area that is susceptible to secondary infections. When a patient presents with a brown recluse bite, laboratory testing is not typically needed. If they present with systemic symptoms, then labs will need to be ordered. However, it's important to keep in mind that it's uncommon for a patient to present with systemic symptoms. If needed due to systemic toxicity, a CBC, CMP, and coagulation studies will need to be ordered. These labs will evaluate for potential complications of systemic toxicity, such as hemolysis and acute kidney injury. In addition, you may consider a plain radiograph of soft tissue at the bite site in order to evaluate the extent of soft tissue damage. The management focuses on care for tissue necrosis that may occur at the bite site. The first step is to ensure that the patient is stable and not experiencing any systemic symptoms. After this is ensured, you can then clean the wound and debride any necrotic tissue. If the wound appears infected, you can then prescribe antibiotic therapy in order to prevent progression of the infection. First line in these cases is clindamycin in order to cover staphylococcus. In severe cases where there may be concern for MRSA, vancomycin can also be used. Before the patient leaves, you'll also need to ensure that they are up to date on their tetanus vaccination. Now that we've covered brown recluse bites, let's move on to discuss the black widow spider bite. Again, here is a list of the topics we'll be discussing with regards to the black widow bite. Let's begin with the clinical presentation. Similarly to the brown recluse bite, a patient that has been bitten by a black widow spider may not even remember the bite. However, some patients may report a burning or sharp pain at the bite site. The examiner may also see 2 small pinpricks from the fangs of the spider, or swelling and localized diaphoresis in the area. Systemic symptoms are more common in black widow spider bites and may include chest pain, palpitations, shortness of breath, headache, cramps, muscle spasms, nausea, vomiting, and refractory abdominal pain. In some patients, the refractory abdominal pain may be so severe that it can be confused with an acute surgical abdomen. Here is an image of a black widow spider. The patient may describe a black spider with the characteristic red hourglass marking if they saw the spider that bit them. All right, now let's discuss complications. Neurotoxins in the black widow spider venom can have an impact on multiple organ systems. If the venom affects the heart, the patient may experience cardiac dysrhythmias, feel heart palpitations, or even develop myocarditis secondary to the venom. The pulmonary system can also be affected, leading to pulmonary edema or respiratory failure. Neurotoxins in the venom can also cause muscle tetany, fasciculations, tremors, muscle spasms, and even autonomic instability. These effects are due to the fact that the neurotoxins in the black widow spider venom lead to exocytosis from presynaptic nerve terminals, including those that release acetylcholine, norepinephrine, dopamine, glutamate, and other neurotransmitters. Because the effect that black widow venom can have on different organs, laboratory testing is helpful to determine if any damage has been done. However, there is no specific test to determine if the patient has been exposed to black widow venom. Instead, you'll order a CBC, CMP, and cardiac enzymes such as troponin. These labs will help give you an idea of any organ systems that are being impacted by the venom. In addition, the patient also needs an EKG and cardiac monitoring due to the risk of cardiac dysrhythmias secondary to a black widow bite. If the patient has any respiratory complaints such as shortness of breath, you'll also need to order a chest x-ray to evaluate the presence of pulmonary edema. Okay, now let's move on to management. The first step is to stabilize the patient. Remember that the venom can have an impact on several organ systems, so you'll need to provide supportive care for any of these complications that you find. After the patient is stabilized, you can provide wound care for them, such as cleaning the bite site. There are several medications that can be prescribed in order to make the patient comfortable, including analgesics, antiemetics, antihistamines, and benzodiazepines. If the patient is experiencing severe symptoms and organ damage secondary to the black widow bite, you can also consider administering antivenin. However, the risks of black widow antivenin are similar to those of snake antivenin. The patient could experience a hypersensitivity reaction or serum sickness. And again, you should also consider whether or not the patient needs a tetanus vaccine prior to going home. Here is a nice table summarizing many of the bites that you need to know for step 2. At the bottom of the table, you can see some of the highlights of the brown recluse bite and the black widow bite. All right, now that we've covered the information, let's review with a question. A patient presents with chest pain, palpitations, and cramping. Upon physical examination, there is swelling around the patient's left ankle with 2 small puncture wounds. What is the most likely offending organism, and what can be administered to help ease the muscle cramping? All right, this patient presents with cardiac symptoms of chest pain and palpitations coupled with muscle cramps. The swelling around the patient's ankle with 2 small puncture wounds should make you think that this patient was bitten by an animal, most likely a smaller one like a spider. The swelling and fang marks are more indicative of a black widow spider bite than a brown recluse, which would present as a purple center surrounded by an erythematous border. Additionally, systemic symptoms such as chest pain, palpitations, and cramping are more common with black widow bites than with brown recluse bites, which do not typically show cardiac involvement. Therefore, this patient was most likely bitten by a black widow spider. If a patient who has experienced a black widow spider bite has severe muscle cramping, they should be offered benzodiazepines in order to relax the muscles. So, the most likely offending organism is a black widow, and benzodiazepines should be administered to ease the muscle cramping. And that concludes our section on spider bites.